Hi everybody, it's Dr. Newman. One of the things that people don't understand is that when we get a vial of Botox or a vial of Dysport, it doesn't come as a liquid, as a full vial. The doctor or whoever's doing the injection has to mix it. It's almost like it's a powder. And we then have to mix that, and there's a correct way to mix it. And by correctly mixing it, you then have a concentration that's correct. You mix it with too much or you mix it with too little, it changes the effect, it changes how the Botox then gets distributed once you inject it. If you use too dilute a concentration, then it may travel a little bit in ways that you don't really want it to travel once you inject it. What you're injecting is still a liquid, and it's a liquid that contains the toxin in it. That liquid has the ability to migrate once you inject it. And if you inject it too superficially or too deep, it kind of spreads out inside. And if what you're injecting isn't reconstituted properly, then you're injecting something that's too dilute or too concentrated, and the effect all of a sudden becomes more unpredictable. So it's important that whoever does your injections is reconstituting it properly. When you look at doctors who charge for this by the unit, how many units you're getting is not really based upon how much they're injecting, because it changes based upon how they dilute it. So be careful. In my practice, I don't charge by the unit. I charge by the result. And if patients need a little bit more result, then I'll give them a little bit more Dysport or more Botox. When they come back in, I don't charge for those touch-ups because people are paying me for a result. That result is very dependent upon not just how I inject the Botox, but also how it's diluted. So it needs to be diluted properly.